Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online. News that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thank you for joining us on this special edition of Newsmakers. I'm Fred Martino. I'm very pleased to tell you that for the next half hour, we have as our guest the new Secretary for the Children, Youth, and Families Department in New Mexico, Brian Blalock. Brian, thank you so much for being with us.
Thank you.
So to start off with, Brian, this is a big job. A lot of people watching this show right now have seen stories, I'm sure, in the newspaper or heard stories on KRWG radio about the CYFD, but they may not know, I didn't know, the incredible scope of things that fall under this agency. I was looking at your website, which is very informative and gives you a background on that. If you could start there to talk a little about all of the different things that CYFD oversees.
Sure, and I say from the onset, I mean, that's one of the attractive things. I think it's a real strength in New Mexico that you have a youth-serving agency, a state government agency that has combined a bunch of different things that in other states are actually separate departments. And so then you have separate silos and separate budgets, and therefore you have kind of finger pointing about whose kids these are. It's a real strength in New Mexico that we have them all in a single department. And so right now we have the protective services, so the child welfare services helps with youth who may not be able to stay home with parent or who are struggling to stay home with parents. We can provide services to be sure they can stay home and be safe. We also have the Juvenile Justice Division at Children, Youth, and Families Department. And then we are the Behavioral Health Care Authority for kids under 18. So that means for mental health services in the state of New Mexico, CYFD is responsible for working closely with HSD, we're the Health Human Services Department, in order to be sure there's enough mental health services for youth. And then finally, we have the Early Childhood Department providing things like childcare and home visiting for 0 to 5.
Okay, so an awful lot of different things, and of course, just starting this job, I know one of the things you're looking at is a strategic plan to coordinate all of the needs for all of those different areas.
That's right. So I'm still in listening mode. I think I'm about day 82 on the job at this point, and 60 of those was the legislative session, which was a very intense sprint. And I'm happy to say that quite a few very good things for the youth of New Mexico was passed as part of that legislative session, which I'm really excited about and excited to work on the implementation with those. And so right now I'm kind of traveling all over the state, visiting CYFD offices, talking to stakeholders, getting a better sense. And then I would say we have kind of a draft frame of a strategic plan at this point. There's just some things that we know that we need to do. I think we kind of arranged those in 3 or 4 buckets, and so we're really looking at kind of increasing our appropriate placements, really focusing on prevention, really focusing on optimization, looking at our data systems, looking at our accountability, and then really focusing on our staff as well. I think we have some long overdue things to be sure that our staff are supported and are able to really go and keep doing awesome work.
Okay. I know another thing you wanted to talk about today is Kinship Care. Explain that.
Sure. So so relative caregivers, they're really the backbone of any child welfare agency. So if we have youth who are not able to stay home with parent, it's usually kin who step up and make sure that those youth end up somewhere safe and supported. And usually when we say kin, it's a shorthand for grandmas, honestly. If you look at it kind of demographically, it's usually seniors, usually on fixed income, grandparents who are taking in their kids. I don't know about you, but it's not necessarily my retirement plan, is to take care of my grandkids. And so that's part of it as a system for us to look and really listen to grandparents and to kinship care providers who are providing care to hear what they need so that we can better support them.
So I'm a member of AARP, and I have seen a lot of articles about this. This is not just an issue in New Mexico. It's all over the country where more grandparents are having to become primary caregivers for their grandchildren due to some sort of circumstance with the parent or parents.
That's right. And so when the safety network fails and kids can't stay at home, they end up in grandma's house. So in the state of New Mexico right now, of our kinship care on our foster care side, we place about 20% of our kids with relatives. That's not bad, but if you look at states who've focused some attention and really tried to do that, it's closer to 40%. And so I think that's a good goal for us. And then in states who've really focused some money and some attention and expertise, gotten good at it, it's northward of 45, 50% that they're able to do. And so I think there's real growth. So if you think that there's 2,500 kids in foster care at any given time in the state of New Mexico, about 20% are with kin, so about 500 kids total. But on the other side of it, if you think about informal care, so that's grandparents who are playing some primary care role, maybe full-time, maybe not, in the state of New Mexico taking care of kids, it's about 13,000. And so we need to kind of look at that population and see where's the overlapping population, what can we do to better support, sit down and listen. And so far when we've listened, what we've heard loud and clear from relative caregivers is they really need two things. They really need help with behavioral health care services. So you have kids who've experienced a lot of trauma. They've experienced a lot of disruption, care disruption, maybe school disruption. They could really use somebody to talk to, or they could really benefit from play therapy. They could really benefit from that type of thing. And so building out those community-based mental health services for those kids. And then the second thing, relatives need cash. I mean, it's sometimes, if a lot of times, especially grandmas, fixed income, making it work. We place a youth there that they didn't know that they were going to get, their grandson or their granddaughter. And so then over time, they're doing everything they can to love that kid. And so a lot of times they're maxing out their credit cards. They're having a hard time keeping up and taking care of those kids. And so as an agency, we have a real responsibility to listen and to try to be responsive to that.
Okay. I want to talk a little bit more about one of the things you just mentioned, community-based mental health services. As you mentioned at the beginning of the program, you oversee this for young people in the state. And we, on a recent episode of this program, we actually talked with some filmmakers who had been studying behavioral health across the state of New Mexico, not just for kids, but for adults, because as you're probably aware, during the last administration, there was a massive disruption in service due to some actions taken by the state. And a lot of work has been done and continues to need to be done, according to advocates on this. Tell me about CYFD and what you think you're seeing right now about what needs to be done to fix this challenge.
Sure, I can tell you what we need. And so youth who are on Medicaid, and that's north of 90% of all of our kids that we're working with in the Child Protective System. It's more than 70% statewide of the children are on Medicaid. When they're on Medicaid, and if you're on Medicaid and you're under 21, you have a part of Medicaid that's called EPSDT, Early Periodic Screening and Diagnostic Treatment. That's a legal entitlement. It's a component that's part of Medicaid, and it has a very important part of it that says that a person who has Medicaid is also entitled to anything that's necessary in order to correct or ameliorate the effects of a disability. So what that means from my perspective with the kids that we work with is they've experienced some serious trauma. And so we need community-based mental health services to be sure that they're able to overcome that trauma, that they're able to heal, that they have somebody to talk to and somebody to work with them that's professional that can help make that happen. An important part of that component, though, is it's pretty established nationally and in case law, so we're talking about legal entitlement, that no kid should have to be institutionalized to get services. And so right now, if you look at the state of New Mexico, because of what's happened in the last 10 years, we look at, there's just a dearth of community-based mental health services that are in the right place at the right time in order to help youth so that they don't need to be institutionalized. And so that's really what we need to build. Something like, for example, therapeutic behavioral services, short, intensive, community-based mental health services designed and really focused at behaviors or needs in order to be sure that a youth doesn't need to be institutionalized and can stay home, which is honestly where we want all our kids, whether it's home with parent or home with grandma or home with a non-relative foster parent, and not in an institution except for those kids who absolutely need it. And I think I think what that means for the state of New Mexico is we have some work to do to rebuild that trust, to rebuild those relationships with providers, and to really start expanding those services so that they're available to youth at the right time.
Okay. Well, let's talk about some of the work that is starting. You mentioned that you were here during the legislative session, one of our long sessions, which is 2 months. And you say there were some good things that happened for young people and for CYFD during the session.
Right. I mean, just to start off, I've just been so impressed by the legislature. This has been generally true, too, by everyone I've met. The focus and attention and commitment to youth in the state of New Mexico. It's so inspiring. It's a reason I'm really glad I'm here, because even though I think we have a lot of work to do, there's a lot of people who are ready to dig in and help. That was certainly true in this legislative session. There was a lot of legislators on both sides of the aisle, in both parts of the legislature, who were very dedicated to finding some solutions for kids. We got some real wins, I think some real wins for kids in New Mexico. Some things that were probably, some of them a little overdue. So I think about SB 23, Senator Padilla's bill. It brings extended foster care to the state of New Mexico. Will be the 37th state to implement it. What it does is a voluntary program that if a youth is in foster care on their 18th birthday, they can voluntarily stay in until 21. The benefit of that is they get guaranteed housing until 21, including a housing subsidy program that they can take anywhere in the state. They can take anywhere in the country in order to rent housing. It's just like something similar to what a parent might do when you turn 18. You don't kick your kid out. You turn 18 and you start thinking about college. You start thinking about, you continue to help them with housing so that they have that airstrip, so they have a little bit more time to take off and transition to successful adulthood. With kids in foster care, we are the parent. And so this allows us to provide that care the way that we would want to, which I think is really important. Another great bill is HB 230. It's a great bill, is Representative Trujillo. And what this bill does is it does two things really important in the state of New Mexico for substance exposed babies. It creates mandatory plans of care for those babies. It has a framework. CYFD gets to roll out some of the training and really build the relationship with the medical professionals. So they're creating plans of care to really take care of the baby, be sure the baby is safe, and with the parents and the caregivers to be sure that they're getting treatment they need in order for that baby to safely stay home. And then the second thing it does that wasn't happening is there's mandatory notifications back to CYFD. So now for the first time in the state of Mexico, any baby that's born drug exposed in the state, there's notifications back to us so that we can track data, see trends, and deploy help when we need to.
Okay. Help is needed. I know this, not just in CYFD, but in departments all across the state of New Mexico. I know one of the big takeaways from this legislative session was a need for additional resources because essentially during years of austerity, positions were not filled. A lot of positions were left unfilled. And you do very labor-intensive work. I noticed that on your website, one of the things that I saw was that you are supervising home visits, and that's very labor-intensive to go to homes and see how young people are being taken care of, where they're living. As I understand it, experts say that this is a crucial service in the work that you do. Tell me about where things stand on staffing to do things like home visiting.
Sure. So I think there's no secret. We have a number of vacancies in a couple of our departments. We're in the process of right sizing. So right now, if you ask me exactly how much staffing we would need, how big we would be, what our budget would be, I couldn't tell you. I think there's some right sizing and really looking at kind of our cross-departmental work within our division to figure what that is. I'll give you an example on the juvenile justice side. Because of a series of reforms that began in New Mexico since 2008, the number of youth who are actually juvenile justice involved and confined in our facilities has dropped precipitously since then because of a number of reforms. And in a lot of ways, I mean, we have a JDI best practices module in Bernalillo County. People from all over the country come to see and learn from what New Mexico is doing with juvenile justice. As that shrinks, some of our other departments really need to expand and really think about, for example, behavioral health care. We've talked about growing community-based mental health services. I think because of what's happening in New Mexico around mental health in the last decade, as a result, we have a much smaller budget and a much smaller supervisory structure at CYFD for behavioral health care than what we need. We need that to be much bigger if we're actually going to meet the need and support those youth. And then in protective services as well, we have a number of vacancies. Some of our offices, some of different parts of the state are hit a little bit harder than others. And that work is really intensive, and it's really laborious, and it's high stakes. So if you imagine you're doing your job and you're essentially saving kids' lives, you're meeting parents when they're having the worst day of their life, You're trained so that you know that people are not their problems. You're there in order to help them so that when they're not having the worst day of their life, the damage that they've done because of that day is not permanent, that they're able to mend and heal and get their child back. And so you're doing that every day and you're doing an amazing job. And then that one day where you make a mistake and you make that wrong decision, that's the day that everyone pays attention. That's the day you're in the media. That's the day the news stories are done. That's the day your supervisor calls you. That's the day that all that stuff happens. And so to actually work at CYFD and have that high stakes where it's no credit and all blame, that's something we have to change internally. And so we're looking to really tell the good stories of the work that we're doing so people know. And then honestly, when bad things happen, it's my fault. It's the people at the top's fault because we didn't create the structure in order to allow that. And so I think that's an important message back to our staff to really liberate them, say, go do awesome things for kids, and then we're going to do everything we can to be sure that there's no errors by creating really good structures and support.
You have a really long history of working in organizations to serve young people. Where does that desire come from?
Well, when you see a youth that's struggling and you have the opportunity to do something in order to make their lives better or their day better, I can't imagine not wanting to do that. I don't think very many people would not want to do that. And so I think it's less of a question of where that comes from and more just the fact that I've been really lucky in my whole career to find myself in situations where I can work and help make youth's lives better.
Mm-hmm. You came to the job from San Francisco building public programs for homeless youth. Tell me about that.
Right, I worked at an organization called Tipping Point Community. It was a nonprofit based in San Francisco, but worked in 6 counties around the Bay. And I was the head of the policy department there. And so what that meant is we did a research and development or an R&D framework, which means we would partner with the public sector, figure out what we both agreed was not working so well, and then we would put in innovative practices in there, sometimes provide risk capital, sometimes navigate the funding stream so they had the money they need in order to be able to build things, track the data and the evaluation, and then the things that work, we would help them keep it, help them figure out how to pull down the funding streams in order to keep it in perpetuity going forward. I will say one of the first things we did, because that all sounds very abstract, one of the first things we did is we worked with a nonprofit called Voices that does absolutely the best youth development programs I've ever seen, and we hired 7 youth, all 19 to 29 with lived experience either in foster care or homelessness, most of them both, and we hired them on as our full-time policy advisors. And so they were full-time staff, and anytime we had an idea or they had an idea, we would workshop it and see if it was something that we could actually do together.
Yeah. I know in California, you also worked for an organization called Bay Area Legal Aid, and you represented young people in the juvenile justice system. Tell me about that work and some of the major issues in juvenile justice today.
Sure. So juvenile justice, I think, ever since GALT, which was a lawsuit that established that every youth that's involved in a juvenile justice case that's looking at a loss of liberty gets an attorney. Ever since GALT, the juvenile justice system became increasingly more and more like the adult system. And I think what we know at this point, because of data and because of practices all over the country, is the more you treat young people who violate the law like adults, the more you make young criminals. And the more that you treat young people who violate the law as kids who have made a mistake, the more likely you are to help them transition to successful adulthood. And really coming from a framework of where's the trauma, where's the adverse childhood experiences, what services can we provide in order to kind of make that change. And so to me, the most exciting stuff that's happening in juvenile justice, and we did a lot of this in the Bay Area, that's happening all over the country, is really bringing a public health lens and a behavioral health care lens to the juvenile justice field, where you're looking at it from an epidemiological perspective, you're looking at your hot pockets in your community around trauma and around violence, and then you're going and really doing preventative work in order to stop that from happening before it happens. And then once it does happen, you're looking at the effects of trauma, really from a behavioral health care lens, in order to figure out, well, what's the services so that we can help young people heal, so we can help them not do damage and harm to themselves, not do damage and harm to others, and give them a chance for their brain to develop, so they get to the point where they transition to successful adulthoods and are in a situation to then come back and teach youth about how to get through those difficult situations and how to move on.
Okay, so that was a more recent job after you attained a law degree, but I know early in your career, one of your first jobs, actually, maybe before you ever imagined you'd get a law degree, You had a teaching position at a high school in the Bronx. Tell me about how that informed your life and your career.
Sure, I love teaching. Sometimes I think it's the only thing I do well. So I taught in the South Bronx at 139th and Morris, and I taught English and social studies and whatever else they needed me to teach. I think it did a couple of things. I mean, so I originally grew up kind of on the edge of Appalachia, and then ended up in Harlem and Boston and Harlem and in the Bronx in order to teach. And I think just the sheer diversity of those experiences has really done me well. And I learned a lot from the youth there. They really taught a lot of things. Some of them could read at a 3rd or 4th grade level, but their ability to talk about things, to talk about affairs, to navigate things that I think you or I would have a hard time navigating, that they're navigating day to day. I mean, they were raising their younger siblings, they were taking care of their grandmas, they were managing food in the household and doing all that stuff, just real incredible skills. Some of them just having geniuses in different areas and hadn't necessarily had the opportunity to really figure out how they could take those advanced skills and apply them to schoolwork. And so that was my job, was basically translating, taking these brilliant young people in the Bronx and helping them translate their skills so they could be successful in the school setting. And a lot of them did. I mean, just really remarkable youth.
Some people, when they have that experience early in their careers, they continue on in teaching. Other folks never work with youth again. Tell me about how you think you went into this other area where you eventually became an attorney, but stuck with young people.
I think, so they closed my school down in the Bronx. If they hadn't done that, I might still be there.
You might still be a teacher.
Yeah, absolutely.
You liked it so much.
I love teaching, and ever since, actually, I went to law school, and I still taught. I taught in juvenile halls through a program called Street Law, which I really, really enjoyed. When I got out of law school and became a lawyer, I've been doing a lot of training steadily of other people in the legal field, and also do a lot of trainings for youth. It turns out if you let youth know what their legal rights are, they go and enforce them themselves. They don't always need adults to go behind and do it. They can do it themselves, and they just have knowledge. And so doing a lot of that stuff, and now, I mean, I really enjoy, I still teach. I'm a visiting lecturer at law school, and I really still enjoy doing that as well.
Yeah. So one of the things that is a dynamic, as you know, in New Mexico that is so important to understand, especially working with youth, is that we're one of the poorest states in the entire country. And kind of reflecting upon what you said earlier, that you've noticed in the short time you've been here, the efforts that are underway to try to compensate for this. They're not just in CYFD, but they're in other areas. One of the things we've been reporting on is the community schools concept. And we have a community school in Las Cruces here, Lynn Middle School, where young people who may be dealing with major challenges at home and extreme poverty have services in the school, everything from healthcare to a food pantry to counseling. How important do you see this for the state? Because in a way, this relates very closely to some of the things that CYFD touches.
I mean, I think it's all interrelated and connected when you're talking about youth. So when I started my career as a lawyer, I was an education lawyer. And then at a certain point, I realized that some of the best things I could do to help improve education for youth was not actually do education law, but it was to do income stability and healthcare law. There was a great study that came out that showed they increased the TANF benefits for a family by around $2. And then they saw an increase in the percentage of high school graduations by increasing the amount of money that was going into the home, which is huge. I think that they're all related. Kids who've experienced a lot of trauma, who are experiencing a lot of poverty, it's really hard to pay attention in school when you're hungry. It's really hard to pay attention at school when there's domestic violence happening at the home. It's really hard to do your homework when things like that are happening. So I think it's really important. Community schools models a really good way to do it. I think that the model is a little bit less important, though, than just being sure that there's enough services out there, whether it's community-based mental health services, whether it's access to legal services, all of those things I think are vital.
Yeah. Certainly a major part of the legislative session focused on education, and there even is the formation now of an early childhood education department. How do you see this fitting in and the importance of this in our state?
So one of the welcome surprises in New Mexico is the strength of the early childhood. The state has invested a lot of money in childcare, which is one of the best possible interventions to help families move out of poverty, and in a home visiting program, which really increases safety and really increases preventative services to be able to keep kids home and help support the family in order to be able to do that. I think the creation of an early childhood department is probably going to become a national model, because what it does is it takes some really incredible work, pulls it out so that we can really focus on it as a state, really invest in it, so that the services really track the outcomes to be able to show it. And I think it's an exciting time for early childhood services in the state.
Okay. Just have a little less than a minute left. Anything that you wanted to add as we close out our discussion today?
Well, I think I'm really looking forward. I mean, there's a couple of reforms from the legislature that's happening. We mentioned it before, the HB 230 for the babies all the way to SB 23 to kids exiting out of care and really being able to support them. And I really feel like it's an exciting time. I know the governor certainly has put children and CYFD as one of her priorities, to be sure that we're pushing it forward. And I'm looking forward to seeing what we can do in the next 4 years together. Okay.
Well, we certainly appreciate you at the beginning of your tenure as Secretary of the Children, Youth, and Families Department, sitting down with us and talking a little bit about the challenges ahead, and we wish you the best of luck.
Thank you, sir. Appreciate it.
Thank you as well. Brian Blalock, he is the new Secretary of CYFD. I'm Fred Martino for all of us at KRWG News. Thanks so much for joining us on this special edition of Newsmakers. Have a great week.